Also, since Friday, Prince Edward Island has become the last province to report COVID variant case, and British Columbia has announced the emergence of a fourth mutation associated with travel to Nigeria. So for a closer look at the new threat posed by all these variants, we're joined by a familiar face on this program, Dr. Christopher Labos, and he is an epidemiologist and cardiologist, and he joins us from Montreal. Always good to see you, Dr. Labos.
Thank you. Good to see you too.
Let's talk about this. A study published Friday in the UK examined the variant first identified there, saying it could be 30 to 70% more deadly than the other variants. We've already been concerned about the fact that it seemed to be more transmissible. We now have variants in all 10 provinces. What are your thoughts?
Well, I think we have to realize that, as this pandemic proceeds, we are going to see these variants. Going forward, we're going to have to be a lot more careful about international travel, about quarantining people when they come back, if we want to prevent the importation of new variants from overseas. But going forward, I think we have to assume that at least the dominant variants now, like the UK variant and the South African variant, do already seem to be here. There seems to be community transmission. So it does look as if these variants are already circulating in this country, and that if we want to prevent their spread, if we want to prevent them from having a major impact and potentially undoing some of the good that we've done over the past couple of months, then we're going to have to maintain, at least to some degree, some of the lockdown measures that have been put in place, because regardless of which variant you're talking about, regardless of how more transmissible or deadly it is, if you stay home, your risk of getting sick remains zero. So the fundamental stuff that we've always talked about still works and probably becomes even more important going forward.
If some of them are deadlier and more transmissible, do you think, though, we might have to revisit some issues around, for example, exposure time or extra mask wearing or this kind of thing?
Potentially. And I mean, just recently, the CDC published their study saying that they found that double masking was more effective because when you wear a cloth mask over a surgical mask, you have the better seal around the mouth and nose. So I think when you look at that, I think it requires very little extra effort to do that type of double masking, that it's certainly reasonable. Again, with respect to exposure time, it's very hard to quantify how much exposure time is really necessary to get sick. People have used the number 15 minutes, although that is a little arbitrary. The point is, do less, right? If there's something that can be done remotely, if there's something that can be done over telephone, over the internet, that's probably preferable. The less contact you can have with other people, the better off you're going to be, because this virus, despite its mutations, despite its variants, can only be spread person to person. So if you don't come into contact with other people, you can't get sick.
Okay.
Sorry about that.
Oh, that's all right. I'll let you get that.
It's because it's the earlier time, so my alarm is hitting now rather than when I would normally wake up to do the show.
No need to apologize. We're just glad to have you here in any form. Listen, regional authorities will begin floor-by-floor testing today for all residents at a condo in Mississauga, Ontario. 5 cases of a variant first detected in South Africa were identified there. We've looked, of course, at congregate living. We've looked at elder care facilities and all of that. What about condominiums? What about buildings where there are a lot of people on one floor, in elevators, maybe even in common areas, although presumably not supposed to be? What should we be doing in terms of looking at that?
Well, I think you have to be careful. And I think when you realize, when people live together in groups like that, whether you're talking about long-term care facilities or even just living in condos, I mean, it's not a surprise that most of the cases across Canada have been in urban centers where you tend to have living like that. I think people just have to be a little bit careful. Now, I live in a condo, so I, have the same issue. When it comes to elevators, try to use the elevator one at a time. Don't congregate into common areas. And again, it's the same basic measures. It just requires a little bit of extra forethought. And it's a little bit harder to live in a condo because you usually don't have a backyard. You're sort of limited to using the common outdoor areas. And you might have to give those things up. So, condo living or group living is a little bit riskier because you're more people tacked into a small space. So I think you have to realize that those considerations are important and take the appropriate steps. And the appropriate steps are really, to a certain extent, keep to yourself, limit yourself to your own family.
We, of course, follow the delays in some of the major vaccine manufacturers' deliveries, but Pfizer's president told Pfizer's Canadian president, told CBC News that Canada is expected to get 10.8 million shots of the Pfizer-BioNTech vaccine between April and June. So let's keep this in mind. What effect could that have on our targets for daily vaccination?
Well, there's no doubt that we faced the delays as a consequence of the updates that had to be made in Belgium. So clearly the timetable has shifted backwards. I think you are going to see things pick up in the next little while. So things are going to improve in terms of number of people vaccinated. And listen, things went slowly. That is a consequence of the fact that we don't manufacture these vaccines domestically in Canada. So they had to be imported from overseas. And that was always going to cause some degree of delays. The point is, can we try to improve things going forward? Can we try to get enough people vaccinated per day that we can vaccinate enough of the population in the next few months to really make a dent in this virus?
Canada's most populous province, Ontario, COVID-19 Vaccine Distribution Task Force, they've identified various groups as next prioritization: adults 80 and over, retirement home residents, Indigenous adults. Let's talk about this, the factors that are key to keep in mind when you are targeting various aspects and prioritizing various aspects of the population.
Well, here's the thing. Obviously, you want to get the high-risk groups first. Now, how do you define high-risk groups? That's varying province to province. So it shows you just that there's a little bit of subjectivity that goes into that. I think the obvious and easiest way to do this going forward is going to be age-based group, because it's going to become a lot easier to inform people. It's going to be a lot easier to explain to people who should be going for a vaccine when. And it's going to be a lot easier to manage if you start doing vaccines in non-hospitalized or non-clinical settings. So if you start talking about doing stuff in pharmacies, for example, where it's not going to be very straightforward to identify people with pre-existing medical conditions. So if you tell people, everybody over the age of 80, it's your turn to get vaccinated, that's going to be an easy message to disseminate, an easy criteria to establish. All you need people is to show their driver's license or some other form of photo ID. So it's probably going to be an age-based system going forward, and that makes sense because one of the biggest risk factors for this virus really does seem to be age.
Thanks again for this, Dr. Labos. Really appreciate it.
My pleasure. Take care. Stay safe.
You too. Epidemiologist and cardiologist Dr. Christopher Labos, and we reached him in Montreal.